My name is Christy Call, editorial director of Cure Magazine. In this edition of the Speaking Out video series, on behalf of the National Pancreas Foundation, we're talking with Dr. Andrew Lowy from Moore's Cancer Center at UC San Diego Health about treatment options for pancreatic cancer. Hi and welcome.
Hi, good to be with you.
Thank you. So to start, how does early detection play a role when it does come to treatment outcomes?
Well, early detection is critical for achieving the best outcomes in pancreas cancer, as it is in really all cancers. One of the big problems and challenges we face in pancreas cancer is still our inability to diagnose most patients at an early stage. But when we do diagnose patients with, for instance, stage 1 pancreas cancer, we can cure more than half of them. And when we diagnose tumors when they're very, very small, if we can diagnose them under a centimeter or even under half a centimeter, we can cure 3/4 to 90% of patients. Now contrast that with the fact that most patients are diagnosed when their tumors are large and inoperable or have spread to other organs. And in those circumstances, we cannot cure anybody. So there, you can tell by those statistics, there's a huge difference if we can achieve early detection.
Great. And why is it key to consider treatment at a high volume cancer center?
Well, pancreas cancer is a complex disease for many reasons. It's in a complex area of the body. It's an area of the body where multiple areas of the GI tract intersect. The pancreas has dual functions. It functions in our digestive system by making enzymes that help us digest food, as well as to regulate our blood sugar. And so when you have pancreas cancer, patients face a number of issues. And those issues range from obviously managing their therapy, whether it be chemotherapy or radiation therapy or surgery, to managing these other medical aspects. So multiple providers are involved, and you really need a team approach, a group of folks who work together frequently, see many patients, so they're familiar with all the issues that pancreas cancer patients face, and communicate really well. Certain technical aspects of care, like surgery, are very complex, and there's lots of data suggesting that the best outcomes from pancreatic surgery come from centers that do lots of pancreatic surgery. So there's many reasons why high volume centers are preferred for these patients.
Great. And so speaking of surgery, we read a lot about neoadjuvant therapy. Can you just explain what neoadjuvant therapy is and maybe how it kind of helps to avoid surgery up front for treatment?
Sure. So neoadjuvant really means getting your treatment, usually chemotherapy, before you have an operation. So for patients whose tumors are operable, the traditional means of caring for them has been to remove the tumor and then to give them therapy afterwards. And, again, while that's the traditional approach, it's become clear that that approach has a lot of disadvantages as compared to giving chemotherapy up front. And so I'll go through some of those because there are actually many and that are important to understand. So first of all, a thing to understand is pancreas surgery is, as we talked about previously, is very complex. And it's still, despite the fact that we've gotten better at it, is associated with a high complication rate. And so it takes people oftentimes quite a while, even in an uncomplicated recovery, to recover from the operation to be able to get their chemotherapy. And we know that the best outcomes are achieved when people get chemotherapy in addition to surgery. And so by giving chemotherapy before the operation, when people are still in good shape, before they have undergone a surgical recovery, it ensures that we get that chemotherapy delivered. The next thing that's important is by giving the therapy when the cancer is present, we can get an assessment of whether the treatment's actually working. And that can allow us to continue therapy if it's being effective, or to consider changing therapies before or after surgery to something which may be more effective. The last part that I'll talk about is that unfortunately, a certain percentage of patients, even though we don't detect the fact that there is disease somewhere else when they present, have disease present somewhere else in their body, most often the liver. We don't want to do operations on those patients because those operations are not helpful. And so, as I often say to patients, nobody's ever lining up to have operations that don't help them. And so we don't want to do surgery on people unless we think the operation is really going to help. So by giving chemotherapy ahead of time, we are selecting out those folks who have a better chance of benefiting from the operation, because in the time we're giving treatment, some of those people who have disease in their liver, it will show up as we rescan them. And then we know they're not a good candidate to have their operation. So those are some of the reasons why this neoadjuvant or preoperative treatment strategy, we believe, is a more sound one for pancreas cancer.
Okay. And so with that, that's obviously one option. What are some of the current standards of care for pancreatic cancer right now?
Right. So like all cancers, the treatment selection is based on stage. However, what's different about pancreas cancer is because it's such an aggressive disease, every patient essentially will get chemotherapy at some point in their care. We just talked about the earlier stage patients who have operable disease, where we often will give chemotherapy before their operation. For patients who have tumors that are metastatic, meaning it's spread to another organ, or it's inoperable because it's involving critical blood vessels, for instance, those patients will get treated with chemotherapy. There's two main standard regimens that are used most often for this disease. One is called FOLFIRINOX. These are all acronyms. FOLFIRINOX stands for 5-FU, leucovorin, irinotecan, and oxaliplatin. Those are the drugs that make up the regimen. And the other regimen, it consists of two drugs called gemcitabine and nab-paclitaxel, or Abraxane. Those are by far the two most common regimens. There are other regimens, particularly for patients who are elderly or have other medical problems, because these two regimens, have a fair amount of side effects to them, and some patients can't tolerate them.
Great. Okay. And so, that's current standard, but what kind of treatments are on the horizon for pancreatic cancer?
Yeah, so the exciting thing is that there are more drugs being tested for pancreas cancer than in any time in history. And the drugs span a variety of different classes. One big area of intense investigation is immunotherapy. Most people have heard about immunotherapy because it's really been the most significant breakthrough in cancer treatment over the last several years. But so far, we haven't had success with most current immunotherapies for pancreas cancer patients. And there's a lot of reasons for that, which are fairly complicated. But in short, what we're trying to understand is how we can make the immune system recognize pancreas cancer by using combinations of immunomodulating drugs. And so there's a whole bunch of them which are working on different parts of the immune system that are in clinical trials. Another interesting area is tumor metabolism. Cancer cells have a different way of getting energy than do our normal cells. And there have been drugs developed which are trying to block the pathways that pancreas cancer cells use to acquire and use their energy. And so some of those drugs are even in very late stage trials. And if we're lucky and they show efficacy, they could be approved, even as soon as next year. And then finally, there are targeted therapies, which for most folks have heard about. These are drugs which kind of are designed to target specific alterations or vulnerabilities in cancer cells, often that are identified by studies of a patient's own tumor rather than being broadly applicable like chemotherapy drugs are. So those are the classes of drugs that are, broadly that are under investigation.
Great. Now, to kind of bring it all together, what would you say is your biggest piece of advice for a patient who is considering their treatment options?
So first of all, I think that as we talked about before, Being at a high volume center, and particularly when possible, a National Cancer Institute comprehensive cancer center is always a good idea, or at least to get an opinion from a center if that's available to you. It's never a bad idea, to get multiple opinions to make sure that you're comfortable with the treatment plan that's being presented to you. I think those are, really important, and organizations like the National Pancreas Foundation, provide, information to patients, which can help educate them about their disease, answer questions, and certainly, patients should realize that you're not alone. NPF and other organizations are available to support you, help you through the journey, and make it as easy as possible for you to deal with this difficult disease.
Definitely. Well, thank you so much for joining us today.
Oh, it's my pleasure.